You will now learn how to assess and classify a young infant for very severe disease and local bacterial infection. Young infants can become sick and die very quickly from severe disease, and particularly from serious bacterial infections. They may show only non-specific signs of a very severe disease, such as few movements, fever, low body temperature, or fast breathing. Check every sick young infant for all of the signs of very severe disease and local bacterial infection. We will now show you how to assess a young infant for very severe disease and local bacterial infection. First, ask the mother. Is the young infant having difficulty feeding? A newborn who is unable to feed since birth, or had been feeding well earlier and is not feeding well now, may have a very severe disease. Then ask, has the young infant had convulsions? Convulsions are a sign of very severe disease. Now look and feel for other signs. Make sure that the young infant is calm, and then count the breaths in 1 minute. Do this in the same way as you would with an older child. The cut-off rate for fast breathing in young infants is higher than it is for older children. A young infant, aged up to 2 months, has fast breathing if you count 60 breaths per minute or more. You can review the technique of counting breaths and look for chest indrawing in the IMCI modules and video for the older child. The breathing of young infants is often irregular. The young infant will occasionally stop breathing for a few seconds. This may then be followed by a period of very fast breathing. Therefore, if you count 60 breaths or more, repeat the count to see if the fast breathing is sustained. Only if the breathing rate is 60 breaths or more on the second count should you consider it to be fast breathing in a young infant. Next, look for severe chest indrawing. Mild chest indrawing is normal in young infants because their chest wall is soft. It is not a sign of illness in young infants. This young infant has mild chest indrawing. However, severe chest indrawing is a sign of illness. Severe indrawing is a very deep movement and is easy to see. This young infant has severe chest indrawing. We will now assess this young infant for fast breathing and chest indrawing. Count the breaths Abdi takes in 1 minute. Find an area of the abdomen to watch. Prepare to start counting. Start counting now. Stop counting. How many breaths did you count? We counted 70 breaths per minute. As Abdi is less than 2 months old, and we counted 60 breaths per minute or more, you would repeat the count to see if the fast breathing rate is maintained. If you again count 60 breaths or more in the second count, Abdi has fast breathing. Now look for chest indrawing. Abdi has severe chest indrawing. The indrawing is deep and easy to see. Measure temperature. Fever is uncommon in the first 2 months of life. If a young infant has fever, this may mean the young infant has a very severe disease. Fever may be the only sign of a very severe disease. Young infants can also respond to infection by dropping their body temperature. Look at the umbilicus. Is it red or draining pus? This is a normal umbilicus. It has no redness or pus. This umbilicus is showing signs of infection. The umbilicus is red. Look for skin pustules. Examine the skin on the entire body. Skin pustules are red spots or blisters which contain pus. This young infant has many skin pustules. Look at the young infant's movements. Does the young infant move spontaneously? Does the infant move only when stimulated? Does the young infant move at all? Observe this as you do the whole assessment. An awake young infant, such as this, will normally move his arms or legs or turn his head several times in a minute. This young infant is moving spontaneously. This young infant has no spontaneous movements. Gently stimulate the young infant. This young infant has movements only when stimulated. You will now learn how to assess and classify a young infant for jaundice. Assess every young infant for jaundice. Look for signs of jaundice. It is important to look for jaundice in natural light. Jaundice is a yellow discoloration of the skin and mucous membranes. Many babies may have jaundice during the first week of life. This jaundice usually appears on the 3rd or 4th day of life and occurs because the young infant's liver is not fully mature. This form of jaundice is mild and disappears before the age of 2 weeks in full term and by the age of 3 weeks in preterm babies. It does not need any treatment. Jaundice that appears on the 1st day of life is always due to an underlying disease. To look for jaundice, press the infant's skin over the forehead with your fingers to blanch. Remove your fingers and look for yellow discoloration. If there is yellow discoloration, the infant has jaundice. To assess for severity, repeat the process over the palms and soles. Any young infant who has yellow palms and soles is classified as severe jaundice. This young infant was born 18 hours ago and has jaundice. A young infant who is less than 24 hours of age and has jaundice should also be classified as severe jaundice. This young infant is 4 days of age. The young infant has a yellow discoloration when the skin over the forehead is pressed. However, when the palms and soles are assessed, there is no yellow discoloration. Young infants with jaundice who are more than 24 hours old and do not have yellow palms and soles are classified as jaundice. If the young infant is older than 14 days and has jaundice, refer to hospital for assessment. Next, look at the young infant's eyes. Are the eyes draining pus? If the eyes are draining pus, are they swollen and draining large amounts of pus? If the young infant's eyes are draining pus and are swollen, this is a sign of a possible gonococcal eye infection and is classified as severe eye infection. If the young infant's eyes are draining pus but are not swollen, this is classified as eye infection.